a lot of communities, especially minority ethnic groups, and indeed all cultures, do stigmatize certain things in life, and mental health is unfortunately one of those illnesses. And so because of that stigma, it does indeed affect the way people will view their own situation. Because if, for example, I fear being misjudged because of a certain illness, chances are I will not disclose it, and that will affect any likelihood of any help being offered to me or me seeking that help. A lot of mental health problems are diagnosable, and I would say that there is no cultural difference that passes for a mental illness. So although people do act differently, for example, there are people who are louder than others depending on whichever culture you come from, that should never be interpreted as a symptom of an illness. It's not aggression, it's just perhaps that someone is from culture where tonal variation is different. And therefore, in my own understanding is that all mental health illnesses should be diagnosed and cultural differences should be understood as so, and every professional should work to develop their competencies around working with different cultures.
The stigma around mental health, it's also in UK culture, and it's especially so in other cultures. And the way we deal with that is by starting a conversation within the community to start talking about stigma, and also to talk with mental health professionals around the stigma that they might feel in terms of addressing that with people from other cultures. So that's kind of how we start working towards eliminating some of the institutional racism and all of the other problems that you mentioned. So the barriers that people face are, first of all, language. Then there's a lack of knowledge about the system, their history of migration, whether they've come to this country as a refugee or they've come in terms of voluntary migration. There are problems in terms of entitlement of services, especially for refugees and refused asylum seekers. There's problems around the communication between the migrant and a healthcare professional. So you see already a lot of problems in terms of communication around at the GP level, where mental health problems are not picked up on.